Hi, I'm Daniel Nyman. On behalf of the Forum for Healthcare Strategists, as well as our partners at Populi, welcome and thank you for joining us for Healthcare's Data Access Revolution, getting insights into your existing applications. For healthcare organizations in search of data to inform strategy, marketing, and network development, there's a revolution underway. Point solutions using closed data repositories are being replaced by technologies that enable quick connections of disparate data. That means marketers, analysts, strategic planners can now work smarter and better. In today's webinar, you'll learn how to efficiently access and leverage interconnected claims data and applications your organization is already using. One note before we begin, if you'd like to ask a question, please enter it into the question and answer pane located in the bottom of your screen at any time. We will respond to as many questions as we can in the time we have. With that, I'll turn the program over to Bill Moschella, CEO and co-founder of Populi. Bill?
Thank you, Daniel. Appreciate the introduction. And thanks for everyone for taking time out of your day to attend this webinar. We're very excited about the topic that we're going to be addressing today, and the data access revolution. We believe that there is really a paradigm shift in the way many of you are addressing a number of the use cases that you're faced with on a daily basis with the technology and the tools that you have. And so to start off, I wanted to maybe give a little bit of a background and understanding that some of you are new and possibly coming into healthcare from different industries. Some of you are newer in these positions, and some of you have been here for quite some time and have seen this whole ecosystem unravel. So I wanted to start with maybe going back anywhere from probably 5 to 10 years ago and think about the way that you address problems and the way that you manage use cases across marketing, strategic planning, and business development. And the way that I would refer to it as probably like think of it as renting, right? And you would rent technology and you would rent data. So most of what you were looking at was given to you in a spreadsheet. You were looking at PowerPoint presentations. Direct mail was a major piece of outreach. And CRMs and true database marketing and cloud databases wasn't really a thing in the healthcare industry. And now you fast forward to today, and there's this huge shift. And you've gone from utilizing other organizations or vendors' applications to now being in a position where you're purchasing this technology and data directly from the sources. So you have things like Salesforce and Microsoft and Amazon and Tableau. And the owning of this own tech stack and moving from a renting to actually owning now requires you to be able to have access to certain data sets that you can bring into these tools that you've invested in, not only just the time and the cost, but also the training, as well as all the individuals who are circling around this and utilizing it. And so if you start to think about what that stack looks like from a technology perspective, behind the things that are running behind the scenes of carrying all the information and driving you to all the answers that you require, it looks significantly different than just spreadsheets and PowerPoint presentations and sending your data out to other organizations, essentially, so you can rent an application. And looking at this chart here, it looks completely different than what it would look like 5 and 10 years ago. And so I wanted to point out a few things that are really important for all of us to start to understand and what's affecting this ecosystem. So CRM, PRM, and contact center, although they used to be individual applications, they're now being purchased solely through individual vendors. So Microsoft, Salesforce, Oracle, they've all stepped into this mix. And over the past 5 years, there's been major acquisitions where Salesforce is maybe just a standalone application, now buys Tableau, and they have a business intelligence tool. They have a DMP and a CDP. They buy ExactTarget, and they have a marketing cloud. And Eloquent does, Oracle does the same thing. And I've also put EHR up on here because there's a lot of questions around, does the EHR provide the data that we need? Are the EHRs going to start to become opportunities for CRM and for other tools that we have in the stack? And I think that question still remains open. However, I would like to point out that as of just recently, Oracle, who is mainly on this marketing and technology stack, has now come in and purchased Cerner. So these are all things that you start to think about, just the technology that you're now owning. It's now, these bigger organizations are now not only stepping into business intelligence, CRM, and digital marketing and cloud storage space, but they're also acquiring EHR. And so the opportunity to integrate seamlessly data across this entire ecosystem is significantly different than the way it used to be. However, there is still the problem. And so the problem is that if you're on the right-hand side of the screen and you now have all these tools and you own all these tools, the traditional way that you went and got analytics was sending your first-party EHR data to an organization to build analytics and join it with consumer data or access claims data and then log into another application to go get insights. However, now most of you, if not all of you, have a CRM, have business intelligence tools, have access to cloud data warehouses. So you have this entire infrastructure that just needs to be fed data. But instead, you're traveling someplace to go get it. Whereas opposed, the paradigm shift is you now need to have this data brought to you. And so the black box situation where you can't quite get access to what you need has now changed, and your demands and needs have changed because you have the capabilities to bring this data in. And so as we think about this paradigm shift and what it means to you to really doing your job and solving these problems and going through these use cases that you are facing every day, we're hoping that in this presentation, we talk about what does this mean to you? What are the data sets that you can now start to take control of and that you should consider? What are the opportunities and pitfalls of each? And what are the enabling technologies that map to each of these different use cases and data sets? An ongoing discussion about what the role of the EHR and its data set is in terms of the needs in digital marketing, business development, and strategic planning. And then we will map a use case back to the data and technology in the end to kind of give a comprehensive view of what this universe could potentially look like and what it could mean to you in the way that you operate moving with data forward. So I want to cover a bit of the data landscape and talk about what are the third-party data sources that are available. The data sources that really drive and help you answer a number of the questions that you have across your departments, so strategic planning, network management, digital marketing and segmentation, market access, contact center, they range from first-party data to third-party data. And in some of these cases, when you're looking at a data set on the left-hand side of the screen, it could be first party or it could be third party. And there's different reasons and different use cases for each of those. But medical claims, your 837 and 835 data, your payer claims, specifically your 835 and adjudicated claims, EHR and lab data, AI modeling, so anything that's been built as a derivative work, a forecast, a propensity model off any one or combinations of these data sets, and social determinants of health and your consumer data. So this would kind of represent that broad range of potential data that you could consider as first and third party data being brought together to help answer your questions. So I want to dive into the first topic, which is claims data, and just talk a little bit about it. For some of you, this might be information that you already know, and for some it might be new, and there might be additions that you might learn in this. So I hope this is very useful. So the first question around claims data that always comes up is, where does this data come from? What is it, and what's underneath it all? So that when you assess it and you're looking at purchasing or acquiring it, you understand the nuances between what you may be getting and may not be getting. So claims processors and adjudicators are out there in the revenue cycle world, and their sole purpose is to be able to connect the provider and the payer together. So as a provider, you're submitting a claim requesting payment on behalf of services that were rendered between a rendering physician facility and, of course, a patient and their health plan. And then that situation goes back and forth until that whole claim is adjudicated and there's an agreement upon what's going to be paid. So those processors are managing, from a provider perspective, many providers and many insurance organizations and payer organizations. So what potentially happens here is that you don't necessarily get 100% of one individual patient because it's seen across multiple facilities. Now, when you go to a payer, some payers do provide their claims and analytical capabilities for sale. Now, a payer will have a slightly different view of this, but they might not have the full universe of patients. But for the patients that they do have in their plan, you will see 100% of the coverage for that particular patient. Now, Medicare also has a couple different offerings for claims data. There is a qualified entity program where they are providing 100% claims coverage at an identified level of individuals in the United States on Medicare Part A, B, and D. And that information is provided, as I said, in 100%, and you see 100% of those claims. There's also state data, and now this depends on the state that you're in. And depending on that state, there could be a significant lag. Most state data is going to be 6 months to a year. It's going to be de-identified. It will not have a longitudinal record of a patient. And in most cases, it's going to be institutional and institutional claims, inpatient claims. So you'll be missing that outpatient ambulatory to see origination of patients from a PCP or even a specialist. Now, the common pitfalls that you'll find in claims data as you're looking at this is that there's multiple formats. And so it requires complex integration. It's messy data. So there's a number of missing and incorrect fields, as unfortunately providers aren't the best in filling out this information, and there's a number of fields that are not required. So finding a referring physician on a claim is not a required field. And for many of you who are looking at leakage and understanding affiliations and referral patterns, this is an area why analytics is important, because that information is missing on the raw claim. And in many cases, you're going to need additional data sets to fill in the gaps, to be able to put a provider directory in there, to put a payer master in there, to understand the actual meanings of the codes and crosswalks between the different ICD and CPT codes. So this is an additional set of work that needs to be done over and above just collecting the claims. And if you're trying to fill in gaps, and many of you who have gone through this process would typically ask a question in your market. So for whoever I'm buying claims from or claims analytics, the typical question is, what's your coverage in my market? And that goes back to where you're at, the insurance plans that are in your market, and the types of data that you're looking for. Now, what happens when you start to buy multiple sets of data? So in your organization, one group might be working solely on state data to look at market share. Another one might be purchasing third-party analytics on referral for referral information. Another part of your organization might be receiving claims or submitting claims to do risk analysis for contracting. All these are different sets of data. And to be able to bring them together is very difficult because you don't have a unique patient token. In some cases, it's identified. In some cases, it's de-identified. And so outside of Medicare or purchasing direct from a payer, there's really no comprehensive coverage outside of that Medicare data. So when you're looking at this, understanding the messiness of the data, the use case that you're looking for, and the total coverage, there's a number of different elements to start to think about. And so if you've made these decisions, you're able to assess this, and you want to start to bring this data into the platforms that you have every day, the question becomes, what are my direct connect options, right? So do I need to really bring this into my system, or can I connect directly? So are there opportunities to connect to an existing database and take a business intelligence tool, like you might have like a Tableau or a Power BI, and connect directly to it? Asking your organization about its current cloud capabilities. Are you an Amazon shop? Are you an Azure shop? Are you a Google shop? This is something, just from my own experience, did not exist really 3, 4, 5 years ago. And now almost every provider that we're speaking to has some ongoing robust cloud initiative. So there's more opportunities from a strategic planning and marketing perspective to actually request database services and analytical services, in which in the past is why you really need to rent much of this stuff out to a third party, because you didn't have as many of those capabilities and capacities in-house. And now many of you do, and a lot of them are very mature. And the final question that we typically hear is, should I be putting this information directly in my CRM or PRM? So we could use the example of Salesforce. Do I bring in raw claims directly into my CRM to understand referral patterns or to profile a physician? And really, this comes down to less about can you do it and more why do you want to do it and should you do it? And so the cost of storing data in your CRM could be expensive, the ongoing maintenance and loading of that data. So typically what we would recommend that you look for here is an opportunity to embed aggregate analytics or statistics that can be updated on a regular basis, as opposed to the raw transactions. Now, we do understand that many of you are starting to bring in your EHR data into your CRM, and we think that that's a great idea for your first-party data. But managing this across third-party data can also start to increase the complexity. So it comes down to a question of, what are you trying to solve? What's the cost? And what's the time to value for that outcome? want to move now from claims into more of a view of consumer data, because this is also becoming extremely important as it cross-references these different use cases. Now, a popular acronym and term that's coming out now is SDOH, social determinants of health. And I can go back into my own career history and remember when a number of acronyms came out that really represented something that already existed, but we're calling it something new: the cloud, AI. AI and machine learning really just being generally statistics, and the cloud just essentially being a network of computing. But when these terms come out, businesses are built around them and become disruptive. And social determinants of health is now an important term. And the real reason is that from the research that's going on out there, especially in the clinical and healthcare space, it's proving that the social determinants of health are more statistically relevant in building predictive models and forecasts than the first-party clinical data that you have on your patients themselves. So the best case scenario now becomes, how do I take this data and join it to my existing patient records to append the analytical capabilities of that data? And then secondly, for the patients that I do not have, my consumers, my non-active lives, how do I fill in the gaps and bring that consumer data in to bring a complete view of my patients and my consumers with a tremendous amount of analytical capabilities to build models across both populations and seamlessly look at those markets in one view? So consumer data and social determinants of health, where does this data come from? So there are a number of self-reported data sources out there. I wouldn't recommend that this is the place that you go, but there are now continually more data sources of self-reported information that are very accessible and cost-effective. Now, the most popular is typically the second bullet point, and those are the aggregators. These are the Experians, the Axioms, the Epsilons of the world, who are managing the self-reported data sources and aggregating them and bringing them into one source. Third is what I think is very important, are analytics vendors, because they take that data and then build upon it by adding propensity models, modeling additional data from combined sources of first and third party data. And then finally, data exchanges, which are vendors who are putting data up for download and access with various types of elements on them for you to be able to bring in and aggregate on your own. So the common pitfalls across trying to source and manage your own data to bring it into your systems is that it's not always healthcare focused. So there might be a number of fields and attributes that aren't very relevant to what you might be looking for. PII, PHI, and compliance issues is always going to be the biggest thing. When you start to join social determinants of health and consumer data to additional sets of data, it starts to bring in a HIPAA issue, which can be the re-identification of a de-identified record by adding new attributes to it that didn't exist before. So merging that first party data, that EHR data, also becomes a problem. And now you have this whole job of linking identified records to de-identified records or matching and merging to your existing database. And there's quite a bit of modeling that is required to make all of this data actionable when you're using it on your own. So the stack is somewhat the same. You've got direct connect options for using your business intelligence tools. And I would say in this case, I would think about your BI tools and your CRM as very different use cases. So if I want to look at an entire population and understand what's my available market for individuals needing knee arthroplasty, and I want to see high value targets who are responding to digital media and digital TV advertising, because I want to start to understand that size of that market so I can look at my budget forecasting. You're not going to go to your CRM for that. You want to be able to visualize that on a heat map. You want to bring up dashboards and start to segment that down by gender and age band and household income. That's where you're going to want to have a direct connect option or a database internally that you can connect your business intelligence tool to. The cloud ecosystem is the same here, whether you're an Amazon, Azure, Microsoft, or a Google shop. And then last, putting this into your CRM, and whether you're populating Health Cloud or standard consumer records or lead records, you want to ask yourself the question, if I am able to purchase 300 or 400 attributes on an individual, how many of those are really relevant to being in my CRM system? Do I need 50 of them? Do I need 60 of them? Or do I need 200 of them? And that's where it comes down to the cost and the time to value for how you're setting up your CRM. So if you're working with systems integrators, and you're evaluating, bringing this data in, you really want to start to understand the overlap of these fields and to understand what part of this should just stay in my marketing database where I'm just attaching and connecting my business intelligence tool. And what parts of this should I really be thinking that I need these elements refreshed on a regular basis in my CRM tool to trigger marketing automation programs, journey programs, one-to-one lists, or individual ROI reporting. So now here comes the major question that you all would start to ask yourself. I now know all these different data sets. I have the tools and technology to be able to bring them in and store them on my own. How do I start to bring this together? If I've got de-identified patient records and identified patient records and identified consumers and de-identified consumers, how do I stay compliant? How do I bring this all into one place? How do I take advantage of the massive amount of data that's available to you out there and cost effective, and bring it all together without having this massive IT project that slows everything down that we're trying to do, that kind of pushes you back into the, well, I should just maybe rent this. And I can't fully utilize the platforms that I have all the way because the overhead and the setup of this is too much. And it really comes down to, how do I manage these records? I want to introduce a topic. Patient tokenization. Some of you might have heard about this. Some of you might be aware of it at your organization, and it might be new to some of you. And what I want to talk about is what this actually is and why it is critical to the data access revolution. All we're really illustrating here is the exact discussion that we had when we were going through these individual data sources on the previous slides. And this has been happening in every single healthcare vertical. So medical device, real world evidence, clinical trial studies on the pharmaceutical and life sciences side, payer analysis, and especially now in the provider space. You're collecting data from different sources. You're running data from different sources. Some of you might even be engaged in partnerships with each other where there's data exchanges. And now you need to bring all this data together. You might need to be sharing data with third parties. It still has to happen. It's going to happen. So every time that you have your first party data leave your EHR and leave your security wall, it now creates a massive amount of risk and exposure. Not to mention how difficult it is to then merge and mix it with other data sources, right? And so you have your HIPAA compliance, privacy regulations, and just the difficulty in taking action and sharing this data because it's in silos. So fundamentally, what patient tokenization looks at is two specific things. It looks to take the PII out of the PHI and to de-identify in a way that makes it HIPAA compliant. So there is a HIPAA rule that talks about de-identification of data and the fields that are necessary and the level of de-identification required. I won't necessarily go into all that, but there are just a general handful of fields that we have to encrypt. So we obviously want to remove first name and last name. Maybe you pass through gender. Maybe you don't have exact date of birth and you just go to month and year or just year. You remove your address and you take your zip 5 down to zip 3. These are things that some of you might be familiar with if you've been working with claims vendors or other third-party analytics vendors. When you ask, how come I can't see that population at a zip 5 level? And then the answer is really because of HIPAA compliance and certification rules. Well, when you start to get into the de-identification rules, as you de-identify these available fields, you can then start to create a unique token, which is built on different permutations and combinations of PII. So by adding this token, it's encrypted. It tells you who this person is without specifically giving you the detailed information and exposing that person. So tokens are now going to allow the linking of patient records across multiple sources. So think about it this way. You have your first party EHR data, and then there's another claims vendor who says, I have the ability to be able to provide you some information and claims on individuals who some are going to be your patients and some are not going to be. And now, but I can't give you the identified information because we can't pass that across the exchange. So now if I was able to say, well, I have a token that's a universal token that is encrypted in my schema, and they can pass you that same token, we now start to be able to bring in data sets across multiple providers, multiple facilities, different third-party aggregators. And now it becomes easier for you to store it, maintain HIPAA compliance, and merge these records to build analytics to be able to take action upon them. So really, at the end of the day, this is an important element to solving your problem, right? And if we go back to that problem, paradigm shift. I'm used to sending my first party data somewhere to someone else so that they can run analytics on other tools so that I can log into them and then look at them. But yet here we are today where you own all your own tools, or you're continuing to build on that stack, and you have your own first party data. So you don't need to send it anywhere. So the question becomes, how do I take in that third party data in a very seamless and cost-effective way, so in a safe, compliant way, so that I can start to take action on it? And that is this tokenization. And that's why I'm bringing this up during this presentation, because it is a pivotal part of being able to transition you into this new space of owning your own tech stack, maximizing its value, and taking advantage of the data sources that are out there that you can load and make access of. So let's apply a real world use case to this and look at how we put this data to work. So I'm going to read this verbatim. And we had discussions about this at Populi, and I think what we're trying to capture is something that's not so granular, but high level enough that one could say, whether you're in business development, strategic planning, pop health, or digital marketing and outreach, that you have some part in this use case, regardless of what the service line is. So as a health system, we need to understand the trends, addressable market, how to develop our network, and how to invest our marketing growth dollars for end-to-end breast cancer care. So we've identified strategic planning, facility expansion, physician recruitment, referral, direct-to-patient and consumer marketing, top-line service growth, network management, possibly ACO and at-risk contracts with providers and specific populations. So this use case touches everyone, really, at some level. And then many of you have a piece of this use case that you're tasked with on a yearly, daily, monthly basis to really drive some type of results with. And so what you need to be able to achieve here is to have your strong market position, right, where you're focusing in on those services. That could be procedural, diagnostic, service, and you need to start to segment the population down by geography and cohorts. This could be providers as well as patients and consumers. And then understanding where in that care continuum, where are you losing patients to competitors? Are there alternative delivery methods and service locations? Are there new competitors and entrants that are coming here? Is something shifting from inpatient to outpatient ambulatory? And then if I'm looking at prospective new patients and I'm analyzing consumer joined with claims data, how do I understand how to market to them? So this is a combination of market share, propensity modeling, and analysis. So think about your tools that you have: business intelligence, cloud, marketing automation tools, CDPs, CRM, marketing automation, et cetera. Now you really need to be able to have a combination of your own data set mixed with third-party data to answer this. So let's take a stab at potentially what could this look like. And I'm using Salesforce in this example as a CRM and Tableau as a business intelligence tool. And I've outlined Azure, Microsoft. We tend to find, I'd say, 70 to 80% of the healthcare organizations that we're working with or speaking to are on a Microsoft infrastructure, although we do see Amazon and Google as well. So if we start on the left-hand side and you look at your patient, consumer, and social determinants of health, and then your claims data, bringing this all in to one centralized repository where you can tokenize it, join it in a HIPAA compliant way, run your own data science, or possibly bring in third-party models. It gives it a central landing place so that no one business entity is working in a silo and saying, well, we look at our market intelligence from just purely state data because we like 100% coverage of inpatient data. Now it becomes difficult for all parties to come to the table to be able to say, I looked at this provider of this market and here's the analysis that I have. And you spend time and spend cycles about, well, what data do you have and what analysis did you do and what's your time range and what are your sources? And really what we're hoping the ideal future state can be is that with these larger technology stacks and access to the data, you can all start to decide which data set to work off of rather than it sitting in silos. So if I go from top to bottom and you look at your marketing, you've got physician marketing in a CRM, you've got your contact center, and you have your CRM tool, which not only works in just CRM, but we also have Tableau there, because now you could be looking at populations inside a business intelligence tool. And you could be building dashboards. You can be executing marketing automation programs. Everything is sitting inside that same stack. And you're managing the data and the flow into that from a centralized repository. Population health, utilizing their own data warehouse and some business intelligence tools and strategic planning, looking at combinations of first-party data, claims data, and consumer data to get a full view of at-risk populations. And then your physician relationship management, also tying into the same claims data that you're looking at market share and insights and risk evaluation with, but just utilizing the data more from a volume and a market share perspective, a referral and leakage opportunity, and understanding affiliations with providers. So obviously there is work to be done at any organization to achieve somewhat of a utopia at this level. But if you look over on the right-hand side, and many of you are raising your hands and saying, I have Tableau, we have cloud capabilities, we have Salesforce or Microsoft, then you're well more than halfway there with this opportunity. And it just becomes managing and thinking about and prioritizing the data that you need and to fight the use cases that you need to solve in an ASAP format, and then working your way across the organization to collectively solve these problems. So an ideal state, a number of different permutations off this that could probably work, and not all of it has to happen at once. But this is how we get to a situation where we can answer a comprehensive health system use case internally off of joined data, first and third party, on the applications that you most likely already own and are investing time and money into today. So to summarize, and just by the way, I wasn't going to take a full 45 minutes of anyone's time on PowerPoint, but to summarize today, what I think is important is that you're thinking about building an ecosystem where everyone stays in their own swim lanes but collaborates across. What does this mean? You've got analytics vendors, you've got technology vendors, you've got systems integrators, you've got agencies and consultants. And I've had experience in this in the past where people haven't played so nice in their swim lanes. And sometimes one organization might want to own many of these swim lanes. And what ends up happening is when you want to bring in a systems integrator to start working with data, they're not able to. You want to bring in a consultant or to have access to data so that your internal data science team or a third-party data science team can help you get a project done, but they can't get access to the data. You've got a CRM platform with a healthcare data model and access to tools and cloud tools to be able to connect your own tools to, but you can't because it's in a black box. And so I think as you start to look at how internally you work with your own team, IT, as well as your vendors, and you start to say, these are the swim lanes that we need everybody to stay in to be the best at. Don't be okay at a lot of things, be great at one thing and stay in your lane and collaborate across. That's going to create more opportunity for success in the investments that you're making. So when you look at that, what are my options to be able to directly connect? It might be a lot to ask your organization to spin up a new cloud database in Amazon or Azure and for you to load that in. And that might be a lot to ask for, but that's okay. Seek an opportunity where you can take a tool like Salesforce or Tableau or Power BI and directly connect to an existing set of data where the analytics organization is completely fine with allowing you direct access to that underlying data and analytics, or receive seamless feeds as part of a service. Understand, and simply by maybe asking IT, what's your organization's tokenization strategy? Are they working with an organization like Datavant? Are they thinking about it? Do you already have it in place? We found in a few circumstances that we show up speaking to some marketers or strategic planning, and they end up finding out that there actually already is a tokenization strategy at their organization. It just hasn't been socialized. And this offers huge opportunity for cost savings on integration, compliance, and matching and merging third-party data sets into tools that you already have. So this is just kind of a bonus if you already have it. It's a quick win. Also understanding more deeply your cloud capabilities. So do you have Azure, Amazon, or Google? What's your organization's preferred cloud infrastructure vendor? And what's the maturity level of that? Can you quickly request a database to be spun up? Can you get access to this? What are some of the tools that are available underneath kind of that global contract that they might have? And then finally, understanding, as you look at your data separately from your tech stack, understanding that optionality to select the best folks to go in their swim lanes per use case to manage that cost and to manage the pain of switching. Because when you get to a place where you start to make these decisions and you've started and stopped a number of times, it's probably very painful to think about having to start and stop again. And we hear this often. So understand what kind of flexibility you are allowed in all this to maintain the tech stack that you have, because that's going to be the stickiest thing that you're really involved in. And then understanding how you can bring in and or remove different analytics opportunities or other types of partners into your ecosystem. This is that paradigm shift. It shouldn't be, oh gosh, I have to go with a whole nother complete vendor for everything. It should be, I've got my tech stack. Now I'm going to pick the best for each use case and situation and make that determination. And so it won't be as horribly painful to be able to rip and replace one thing as you move along or enhance it. So I hope that was helpful. I'm happy to take some questions now. And I guess Daniel, I'd open up the floor and see if there's any questions.
Terrific. Thank you so much, Bill. That was an incredibly detailed and informative presentation filled with a lot of data. It obviously raised a few questions. So here we go. First one is, you mentioned bringing in data to a BI layer or a tool like Snowflake. How do these models work and integrate with CDPs that also have AI elements to help determine and make recommendations for actions? So we can bring these data sources together to see likely to convert, likely to need to intervention, but also other items based off your models and other models?
Got you. Great question. A lot in there. Okay, let me start with what I think is the logical progression of that question. So if I'm hearing technology like Snowflake, so we're talking about most likely someone's got, an Amazon type of data store and they've deployed Snowflake as their analytics data warehouse inside there. So the first part of that question really has to do with, I'm hearing there's third-party data. I want it in my first-party owned warehouse. So having an analytics situation where there is a connection, whether it's an API or a direct pre-built connector into a tool like a Snowflake, and then providing access to a data model, a ongoing and publicly available data model with documentation and API is going to be a very important thing. And having that data be accessible through some type of triggered feed, whether it's a push or pull, is going to be an important aspect of this. The challenge in the current ecosystem right now is that you're buying raw data or you're going to a black box analytics vendor. And so the black box isn't going to provide the documentation, the API, or the data model. The raw data is a good option. However, you're now turned yourself into the business of running a healthcare organization to now being a data shop, which has to take in raw data, clean it up, tokenize it, match and merge it, et cetera. So I think when you're thinking about the analytics strategy of getting something into a Redshift, a BigQuery, a Snowflake, it's really about having the pre-aggregated analytics, normalized and cleansed analytics, connectors, data models, APIs, and support and documentation. So really, you're looking for a very specific analytics vendor for that use case that's not going to have any type of problem as a custom request. It should be, yes, we have a connector or a feed for that. Now, the second part of that question goes into taking action from your data warehouse and feeding back. So I'm going to go back a slide here, and I'm actually going to go to this slide. So if I take that question and I look at it on the screen here, that market intelligence and data science and propensity modeling area, that's most likely this customer's centralized warehouse, right? And their own cloud repository where they've stood up a Snowflake analytics instance. From there, this next question about CDP, like a Datarama or with Salesforce, to be able to now build audience insights and push it to different places, that's now becomes the feed from that Snowflake instance directly into Salesforce. Here's the beauty, and I believe it was a CDP Salesforce question. Even if it wasn't, it doesn't matter. because it's all the same. When you now have this solidified data model in Snowflake, and Snowflake is very easy to stand up new databases and create open connections now. You can push that exact data model directly into a CDP and feed a CDP. And most CDPs are going to have a Snowflake connector. So what you're essentially doing from a technology perspective is you're making sure that every vendor in the ecosystem, as they come in from data to analytics to processing to action in your CRM, has a connector ecosystem. And this is a good call out, which is why the black box is not working, because it breaks the chain of seamless integration. If you're using like a Salesforce and you drop that data into your CDP in Salesforce, it instantly becomes available in Health Cloud data model, inside Salesforce, and in Marketing Cloud. And so this is where these vendors, these tech vendors, are becoming very smart. They're making it sticky for you, because once you land on one of these platforms, Oracle, Microsoft, Salesforce, et cetera, they kind of have you into picking the ecosystem that connects most seamlessly with them. And to be able to play in that system as an analytics provider, you need to be having provided and certified connectors to this. That's how you'll be able to flow from data analytics or raw data into the database ecosystem and then into your actionable system. Now, when you're in the CDP, this is the last part of that question, if I'm following this correctly. When you're in that CDP, if you're flowing in consumer data like social determinants of health, I'll give a perfect example. In this use case, I flow in a consumer database with 150 attributes of household income, personics, life stage segments, clinical propensity models, media propensity models, and other types of financial models and health risk models. I flow them into that database and I eventually get them into the CDP. What's beautiful about this is that if you're using a CDP or a marketing automation tool, each time those models change or a variable changes, you can use them as a feeder into a journey program or an automated drip program. And so the flow of these analytics into that CDP from your internal warehouse now start to allow the capability of all sorts of automated programs, triggers from someone submitting a web form, triggers for next best action inside a contact center, automated flow triggers and feeders into automated drip programs and like a Marketing Cloud or an Eloqua journey builder. So it's really a best case scenario. And if anyone can take that and kind of pull that off from start to finish, you have a extremely automated and powerful business intelligence tool.
Great, terrific question, and really appreciate that answer. We've got another one here. I'm not sure if our organization has many of these different enabling technologies in place. So how do I start to understand which ones are applicable to me and which ones we may still need to implement?
Good question. So the use case is going to be the most important place to start, right? I'll give two examples quickly and walk through how I would get there pretty quickly as well. There's much more detail underneath it. I'd be happy to answer questions offline. But let's say that you are in a strategic planning / business development situation, and you're trying to understand growth, leakage, revenue loss, win back, et cetera, right? So it's very much a provider focused question. Now, the number of patients who might make up a panel or a volume of encounters by a provider is somewhat important, but it's not the primary focus. It's really who are the providers who are seeing these types of patients, what's the volume, where are they taking their business, where do they refer their business? It's very much a network management type of question that we're trying to answer. And if I take that use case, I can immediately start to answer the branching questions around it, which I can go to my organization with. If that is a business initiative, stop leakage, win back, keep same store, understand what our PCPs and our employed physicians are doing, and understand where our strength of our affiliations and network is. If that's a task of the organization to grow top line revenue or manage a network, a CIN, ask a couple questions. The first question that I would ask is, what data sets do we have that are informing that? And now if the answer back is, well, we only have first party data, obviously we know that's a problem because you can't see any out of network information. And so the first data set that I would kind of throw up there as an option to start considering would be some type of claims analytics that are going to have referral algorithms and volume analysis about a provider market. Number one. Number two, whoever I talk to, I'm going to want to understand my market, the gaps in the market, and what type of coverage that's going to give me. And if the coverage is going to be relevant enough to be directional on how I make decisions about what's happening in our referral network. The second thing would be more of a technology question. So there are two things that you can then do, at least two major topics that I would be thinking about from a technology perspective. One is, how do I analyze that data, a massive amount of data, to get the insights from within it? And where would I store it? So do we have a business intelligence tool like a Tableau or a Power BI? Because that's how I would need to visualize it. And the second piece is, if I want to take action in the market from a business development perspective, do we have a CRM? Do we have a liaison team? And what kind of data are they empowered with to flow through into that? So that covers my use case, which branches into the data, third-party data that I need over and above my first-party data, the technology that I would most likely need to have or to ask about having access to be able to make sense of whatever I connect to. And then the last part, which is, how do we take action on this? An outreach tool or the marketing tool. What do we currently have in our organization? Is it, do we have liaisons? Is it a marketing automation program? Is it email marketing? How do we reach out to these physicians to start to manage the market and change that? The second use case I will go to quickly will be more of a patient consumer driven type of question. I want to grow orthopedics. We know that we have really great margins on hip and joint, and due to the pandemic, we had a lot of deferred care, and we've had a lot of low margin volume, and we really need to start beefing up our key service lines and driving back that volume and going out there and winning what has been deferred, because we need to really capture that high margin volume. We're going to focus on orthopedics, and I want to go after existing patient population and consumer population. So now that you have your business question laid out, the next question becomes, what data do I need to answer that question? Use case, now go data number two. When I go to the data, in this case, it's a patient and it's a consumer. So the first part of the question may be answered because you could say, well, I have a patient database, and that's going to be able to tell me who our active patients are and if they've ever had that procedure, so I can exclude them or maybe include them, because if it's the likelihood of having, one knee and then the other knee, there's actually a high probability of that in this case. So maybe I'm going to look at that first party data, but now what am I missing? My consumer population. Who are the people that I don't know about? Now I need that additional consumer data. Do we have that consumer data? Do we purchase it? For the consumer data that we may have, how much of the market does it cover? Is it our primary, secondary, and tertiary area, just primary, or is it just a small subset of maybe new movers data that we get on a regular basis? Understand the first and third party data that you currently have, and then look at your use case and decide, how much more do I need to answer the question? And then the last part I would go to would be the technology stack. Same conversation. What business intelligence tool do I have to be able to visualize this to give me aggregate answers on a massive amount of data? And then what type of tool do I have to take action on it? Do we have an agency that we work with? Do we have a digital marketing team? Do we have a CRM that we store the data in? That's your technology question. The additional thing I would add to this is make sure whatever third-party data that you're getting has some type of predictive modeling embedded in it. So the propensity to have a hip and joint replacement, the propensity to have commercial insurance, household income, the propensity to respond to specific media channels so that you can do budget planning. That's how I would look at that. And so I guess to summarize that question, use case branches into, what data do I have? What data do I need? What technologies do I need then to enable an action and take action on that data?
That's great. And I think this is a good transition into probably our last question here today. The use case you put up would normally involve many people, possibly an outside consultant, and take months to develop. Are you saying all this can be done much faster?
Can all this be done much faster? I guess I would say much faster than to maybe how it's traditionally being done today. I would say yes. And then the real question becomes, what's the gap on that? And then also, what's the level of detail required, and getting to a place where you have enough information to take an informed action. If I were to look at maybe this use case and then drill into detail across everything that could possibly happen, yes, it is a major effort to bring everybody together around that, because it's technology, it's data, it's cross-functional departments working together, it's internal and external consultants, et cetera. However, I think that when you look at a use case like this, there's nothing wrong with looking at the current maturity level of your organization and saying, what's the next level of just being more informed? That's really it. It doesn't have to be this utopia while we're all in the same data. It just could be, there is more data that we should get to become a little bit more informed and precise and more predictive. And then how do you look at a maturity level that maybe doesn't take you to the highest point, but is above where you're at? And then if there's external consultants, how do we then now have the tools that we can share with everybody to say, this is the data we're working on, this is the visualization, the way that we've looked at it. Does anybody else have any ways they might want to look at? How do you start to collaborate? I go back to that swim lane conversation. How do you collaborate across that swim lane? So if you think about it in maturity stages, just think about how do I work faster, better, with the tools that I already own, so that I'm more informed than I was before. And just, it's difficult to understand maybe the maturity level of the organization where the question is derived from, but I'd say just take it in maturity stages, be more informed, do it more cost effectively, and utilize applications that you have on existing in your organization. Then the answer to the question is yes, if you do that, it will be faster. It will be much faster.
Bill, I'm sure the audience joins me in thanking you for that terrific presentation. Thank you to everyone in the audience for taking the time to join us today. We'll also be sending out a link of the webinar recording, so watch for that within the next few days. This concludes today's program. We hope to see you at a future forum webinar, as well as the Healthcare Marketing and Physician Strategy Summit, May 16th to 18th in Salt Lake City. Please visit the forum website, healthcarestrategy.com, to learn more and to register. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. Thank you and have a great day.
Thanks, everyone.